Next, we are pleased to present Binaifer Bugley. Binaifer earned her degree in physical therapy in 1990 from Bombay University in India. She is a licensed physical therapist in the state of Michigan. She has worked in acute care, inpatient rehab, and outpatient multidisciplinary clinics at St. John Providence Ascension Health System in Southfield and Novi for 25 years. Currently, she is working in collaboration with otolaryngologist. She's going to correct me on that one later, but yeah. Oh, that was perfect. Oh, she's being very kind. Skull-based surgeons at Michigan Ear Institute. As clinical director of physical therapy and beyond, a clinic specializing in vestibular and balance rehabilitation, dizziness and falls prevention, CranioSacral therapy, and also integrating other highly skilled customized services. She emphasizes a holistic approach, focusing on quality outcomes to help you achieve your goals in decreasing pain and improving functional abilities. Binaifer has been a craniosacral therapy practitioner since 1996 and currently holds a diplomate advanced level certification in craniosacral therapy from the Uplinger Institute. She is a clinical instructor and mentors students enrolled in PT and PTA programs, conducts lectures and presentations for the community and other professionals in craniosacral therapy, falls prevention, and vestibular rehabilitation. Currently, she is a certified instructor with the Uplinger Institute and teaches CST1 and CST for pediatrics internationally. Binaifer will be speaking with us today on the topic of craniosacral therapy and vestibular therapy. Please welcome Binaifer Bugley.
Okay, well, hello everyone. I'm here today to very briefly talk about vestibular rehab, craniosacral therapy, and how these might benefit someone with neuromuscular conditions such as MS. When you think physical therapy, what are we thinking about? Most people think of exercise, strengthening, stretching. Maybe if you have pain, you're thinking about pain relieving modalities, but really, or in actuality, as my friend says, when you think physical therapy, you should think way more than that. Because physical therapy, each person is unique and each treatment should be unique, right? It depends not just on the diagnosis that you come in with, but it depends on the challenges that you present with because of that diagnosis. So am I echoing in the back? You good? Okay. So ideally, the treatments are determined based on a thorough evaluation of what your challenges might be. And then we decide on the treatment in order to address the root cause, not just the symptoms. One of the main things that you hear about with MS is challenges and disruption of the myelin sheath. Myelin is like an insulation that covers all of your nerves, and it helps them kind of address and send messages to different end organs, your muscles, at extremely, extremely high speeds and with specific efficiency, very detailed and great precision. Demyelination, when you come through demyelination, interferes with with those messages. Right? It interferes with how these messages are sent, and they'll have an effect on not just the speed and accuracy of the messages, but how your muscles respond to those messages. So you could have an effect, it then has an effect on how you move or how you respond to your stimulus. Sorry. If you look at this slide that's behind me, you could have things that are an issue with not just gross motor, like big movements where walking is an issue or sports is an issue. It can have lead to challenges with fine motor stuff where you have trouble sewing or turning a page. You could have trouble with your strength, or your strength could be fine. It could affect your coordination. It affects how you could, it affects how you react in that moment in time. So all of those lead to how all of those lead to a lot of challenges with balance, coordination of movement, and how you lead your day-to-day lives, whether it be at home or at work. Being that we're affiliated with Michigan Ear Institute, we see a lot of people that come in with dizziness and imbalance. Now, balance could be due to, imbalance is just a symptom, right? It could be due to a lot of different reasons. So we're always assessing, what is this from? Is it an orthopedic issue? Is it more neurological, vestibular? And more often than not, if you have somebody that comes in with imbalance, they're describing it as dizziness at times. And dizziness is a very common term that people frequently use to describe a variety of different problems. So when someone comes to us with a balance issue, one of the evaluations that we look at is called the sensory organization test. This little colorful box and contraption that you see behind me, it's called the computerized dynamic posturography. This machine, what it does is you have the person stand in here, facing in, and it's a three-sided box. The force plate, the place where you're standing on is a force plate that moves, the box moves, and the force plate is connected to this little computer back here. So we test you on 6 different conditions and give you 3 tries for each condition. And depending on how you do, it gives us an idea of which of the main balance systems are you relying on more or less, or which one's not really supporting you. So any person that comes to us with functional mobility that's challenged or imbalanced, it's really important to address the 3 main balance systems: your vision, your eyes, your inner ears, and the proprioceptive cues that you're receiving, your proprioceptive system, the system that helps you get messages from your legs, from your joints, muscles, that tells you where your body is without having to look at it. Which one is really struggling and which one are you relying on way more than you need to? Once we know that, then we can formulate a tailored exercise program or balance treatment for just that individual. When we're challenging your balance to figure out how far can you go before you lose your balance, safety is a big concern. Most of the people who've had physical therapy are familiar with a gait belt, right? When used correctly, gait belts are wonderful, but we've added an extra layer of safety. So if you look at these overhead rails in our clinic, we have 5-point harnesses that hook up to those rails. They don't lift you up, but they stop you from going down. So it really gives us and our clients a lot more confidence, I would say, in order to push them to do things and work with balance issues that normally wouldn't be safe to do. Oh, there you go. We were playing around a few years ago when we were setting up the clinic to see what we can do with these harnesses. They are actually connected into the structure of the building. So each little segment of that rail can take up to 500 pounds. So we never worry about somebody falling down. But I don't think it's very comfortable to sit and have your tea in those harnesses. That's just for a momentary safety measure. I wanted to take a marketing picture, like a Superman pose, but the harnesses are designed to keep you upright and stop you from falling down. So we couldn't do that. He had to actually hold on to these bars and push himself and hold himself there in that horizontal position in order for us to be able to take this picture. They will, as soon as you go down, it thinks you're falling and it pulls you straight back up. So let's see, where am I at? we know a few basic things about MS, right? And I dare say this in presence of so many neurologists in the room. So we know that it affects our central nervous system. We know that it's a chronic inflammatory disease. We know that there's demyelination, there's neurodegeneration, and that there's an abnormal immune system response that goes on. However, to my knowledge, the question of what came first? What came first? Which one is the root cause that sets off some of the other challenges is still undetermined. So that brings me to talking about craniosacral therapy. Craniosacral therapy has its roots in osteopathy. And by definition, it's a very gentle hands-on technique that helps you detect and correct imbalances within your central nervous system. If you think of what craniosacral system is, it's a system that, it's a physiological system like your cardiovascular system or your GI system. And it's supposed to help you in the production, circulation, and absorption of the cerebrospinal fluid. Cerebrospinal fluid really helps bring about nutrition and remove waste matter, right? It's the fluid that helps nourish and maintain the health of our central nervous system. If you look at this picture, there's where your brain would be and your spinal cord, and there's 3 layers of membranes that surround your brain and your spinal cord. And the fluid flows between the inner 2 layers most of the time, or the bulk of the volume of that fluid. And through very small micro openings, it kind of seeps out into the surrounding brain, spinal cord, and nourishes the nervous tissue. So you say, okay, this is all the way in there. What are you going to do with your hands? How do you have an effect on the central nervous system that far, that deep in our bodies? Through fascia, right? If you think, have you heard the song, the ankle bone is connected to the knee bone, is connected to the hip bone? It's true. It's true. So that's, everything is connected to everything else in our body. If you think of fascia, it's a key player in forming that connection. It helps in health. It's stretchy, it's flexible. If I gain 100 pounds tomorrow, I'm not going to burst. My skin stretches with me, right? But when it's restricted, when you have fascial restriction patterns for any reason, it can affect how you move. It decreases mobility externally and internally. And it can cause a lot of pain. And it can cause random pain, the kind that you could see in fibromyalgia, for example. So I want to share this. There we go. That's a picture from Dr. Gambertou's work. And he's a French osteopathic plastic surgeon. And he developed the way of taking pictures during surgery using an endoscope. And so he has some amazing videos and a book and DVDs and whatever that can share all these images with you. If you look at fascia in real life, it's so much different than what we see when we go to dissection classes and work on, cadavers. So the tissue just is different. It's pliable. Okay. So how does this work and benefit people who have multiple sclerosis, right? So using this gentle technique, using craniosacral therapy, we can actually work on decreasing tissue tension. We work with the restrictions that we learn how to palpate with our hands. And when you release restrictions within the body, now you're allowing the body fluids, including the deeper ones, including your CSF, to flow better, to reach places that it might not have been able to reach before. And remember, we said CSF actually helps bring nutrition, remove waste matter, so it helps improve the health of your central nervous system. When your central nervous system functions better, everything about you functions better. So it's not diagnosis specific, right? It's just about supporting the body and functioning at its optimum level. We learn, it's like learning piano. You can't really learn it by hearing somebody talk about it or reading a book. You have to actually get down and practice for hours and hours in order to feel and learn how to listen with your hands. So once you do that, you can support the body in releasing the tension patterns in whichever way the body needs. Once the body doesn't have to work so hard to move around those tension patterns, now you've freed up the energy that it was using in kind of working around these restrictions to use that energy for whatever else is needed. So it's available for you, okay? And that's that. Okay, before I take any questions, I just want to say a few thank yous. To Yoga Moves MS, to Mindy, wherever she is, and to Lori Svensson for inviting me here to talk tonight. I want to say, I just want to say a big heartfelt thank you and always with gratitude to Upledger Institute and to all past and present out there who have helped me in my learning and my journey through craniosacral therapy. It's changed how I practice. Also, last but not the least, I want to say thank you to Michigan Ear Institute, because without their support, we couldn't have developed this vestibular rehab and balance center, this facility that we have in Farmington Hills, just about a mile up the street. So thank you, everybody, and thank you for listening. Thank you. Over here.
Hello, okay, there we go. Who has a question?
My question is, have you heard of PONS therapy by Helios Medical?
Pons?
PONS, P-O-N-S?
No, I have not.
Okay.
Sorry. Are they, do you care to elaborate? He needs the mic back.
Oh.
It's a therapy where it's a device that you put on your tongue, and it's meant to train your brain to do physical therapy in a different ways, trying to create new pathways.
No,
You
no,
haven't heard
I
of that
have
one?
not heard. I've read something similar, but I don't believe it was called Pons.
Okay.
Thank you. Is any other questions?
Do either of these modalities have anything to do with memory function?
Maybe craniosacral therapy. I mean, it just helps improve your overall health. So, and it helps balance out your sympathetic, parasympathetic nervous system. When you're in a high sympathetic mode where you can't, you're on fight or flight, memory is not ideal. It's not functioning at its best. And so if you can help bring up the parasympathetics on board, that may help. It's a possibility, yes.
Okay, thank you. We've got a question online.
Is there a question, or I'm sorry, how do you find a good craniosacral therapist? And once you have one, how many sessions do you think it takes?
How do you find a good craniosacral therapist? Where there are so many. If you go online to, I want to say, I trained under Upledger Institute, so I'm going to tell you about them. I know there are other modalities out there that use similar cranial osteopathy approaches, and they've evolved in different ways. But You could go to upledger.com or you could go to IAHP, International Association of Healthcare Practitioners, and say, find a practitioner, put in your zip code or put in just the first 3 to 4 digits of your zip code to widen the net. And all the people who trained under UpLedger, even like 1 weekend workshop or 20 workshops, they'll all pop up. And they have their credentials on one side, so you'll know if you're working with a massage therapist, a physician, a nurse, a physical therapist. And as far as how many sessions, it depends on the person. If you're coming in for something specific, most places will say, start with once a week or once in 2 weeks. And then as things settle and get more stable, you can then extend the, treatments to like once a month or as needed.
Thank you.
You're
So
welcome.
time for one more question. Does anybody have a question back here?
Hello.
Does CranioSacral help with?
Does craniosacral help with neuropathy? Possibly, right?
Well, that sounds hopeful.
Because
Thank you.
just remember, craniosacral is not diagnosis specific. We're just helping release restrictions, helping your body function at its optimum. And so whatever changes are going to happen in the body will be supported at that point. So, all right.
Thank
that
you.
good?
Thank you so
everyone.
much.
Thank you.